Thank you very much, Richard. So the foods and the drinks that we consume can really have an effect, obviously, on our teeth. So over the counter, for example, teeth whitening, is that an issue? Is it effective? Does it work? Because the reality is that over time our pearly whites soon begin to yellow. But if you're looking into teeth whitening, does it really make a difference if you whiten your teeth yourself or have it done by a dentist? We're getting some answers to those questions this morning. Joining me now to talk about teeth whitening is cosmetic and family dentist Dr. C.J. Henley. Good morning. Thanks for being here. Do appreciate it. You brought some suggestions and some examples, but let's start with the things that we do, eat and drink, that really cause the problems, because of course we all want to have these beautiful, straight, bright, white teeth.
Sure. So that's a really good question. So drinks like red wine, grape juice, and cranberry juice are packed full of disease-fighting antioxidants, but they have a tendency to stain teeth. Likewise, dark fruits or vegetables have a high nutritional value, but they too have a tendency to stain teeth. So eat and drink up for your health because they're great for you, but after eating or drinking something like that, you really should brush your teeth, and if that's not possible, at least rinse with water afterwards.
So, and to minimize, do you suggest when it comes to the drinks, for example, to use a straw, because then the theory is that it's not all in your mouth and so it's not going to touch your teeth, or no?
Well, using a straw certainly won't hurt anything. It may help a little bit, but it really, if you could just rinse with water afterwards, that would be great.
It's as easy as rinsing with water?
Yes, ma'am.
Okay, wow. Now let's talk about some of the things that we see. I mean, I'm telling you, I go to the store and I'm looking at different toothpaste because my husband wants a certain kind, my kids want a certain kind, I want a certain kind. What works when it comes to whitening? Because you see on there whitening, or baking soda. Does that really work? So
whitening toothpastes contain mild abrasives, chemicals, and polishing agents that are very, very effective at removing surface stains, but they won't change the actual color of teeth. So, when choosing a toothpaste, you should look for one that has fluoride, and that would be the most important ingredient that you can look for. And then when it comes to choosing which brand or what type, it really is a matter of flavor. How do you like it? So, just make sure you'll use it.
So it's interesting because you brought in this Crest 3D whitening, Rembrandt, Tom's. Basically what you're saying is that all of these are going to be just as effective. Not one is better than the other when it comes to whitening.
Correct.
Okay, all right. So that brings us then to, we'll see the over-the-counter, for example, the strips.
Sure.
Or then there's these kind of dental trays that you brought in, which you have to go to the dentist for. Which are more effective, and do the strips really work? Because these can be expensive.
Sure, absolutely. So that's a great question. Whitening products, we've had patients have excellent results with both dentist provide products and stuff that you can purchase at your local pharmacy. The difference between something that is administered by a dentist or something that you can purchase over the counter at a pharmacy is simply the concentration of the active ingredient peroxide. So again, the results will be very similar. It's just a matter of time frame and how long it takes to achieve your desired result.
Can you damage, though, your teeth by using too much whitening strip over the counter, as an example, and cause some permanent, because you don't want to get rid of the enamel, obviously, on the teeth.
Sure.
Can you do that, then, with over-the-counters if you're not careful?
No. The most common side effect that we see with overuse of whitening is simply tooth sensitivity. And with most patients, the tooth sensitivity will subside with time.
Okay. Very good. Thank you very much, Doc. Appreciate it.
Yeah.
And we do want to remind all of our viewers, I know that your partner will be involved in this also coming up in a couple of weeks, and that is that we have this fantastic event that is coming up. It's going to be held at the Prime Osborne Convention Center. It is certainly also open to the public as well for 2 days. It'll be a Friday and a Saturday, and we've posted all of the information on News4JAX.com, but it's our Florida Mission of Mercy. It's April 22nd and 23rd. It's first come, first serve. You don't have to register or anything. It is free to the public. The event strives really to help relieve pain. They're going to be doing things like basic cleanings and fillings to extractions, even root canals, and in some cases they'll offer partial acrylic dentures. It starts at 6 a.m. on both of these days. So if you'd like more information, you can go to our website, News4JAX.com, and look under the Positively Jacked section. Thank you again, Doc, for being here. Do appreciate it.